How the Indigenous children's culture and ethnic background influences their chances of rheumatic heart disease. Firstly, the remoteness of their living areas. Aboriginal children generally live in a more remote area of Australia. This is where they have lived for many generations and therefore can create difficulties in accessing healthcare. The living conditions of Indigenous Australians are less developed than those of European descent. They are more likely to live in smaller houses, share rooms with up to 10 people, and live without adequate heating or cooling. Their traditional background of living off the land is a prime example of Indigenous traditional living. Living off the land can include drinking unhealthy water, which is easily contaminated by the disease, and eating foods which can also be contaminated. Although tradition and culture plays a role in these living conditions, so can the socio-economic status of the family or population. Cultural herbal remedies, which are homemade plant-based medicines, are very common in Indigenous culture. This can be problematic because they do not target the disease appropriately and are not as effective as those more common scientifically proven medications in European culture. This can lead to prolonged diagnosis of strep throat, which then leads to rheumatic fever, and it is this persistence which leads to rheumatic heart disease.
Risk factors. Risk factors are attributes that increase the chances of getting a disease. The Australian Institute of Health and Welfare define risk factors as attributes, characteristics, or exposures that increase the likelihood of a person developing a disease or health disorder. Risk factors are either modifiable, meaning you can take measures to change them, or non-modifiable, which means they cannot be changed. There are a number of risk factors that increase the possibility of acute rheumatic heart disease. Acute rheumatic fever is the number one risk factor to rheumatic heart disease. It is an illness caused by a reaction to a bacterial infection called streptococcus. Recurring cases of acute rheumatic fever will cause rheumatic heart disease. Accessibility to healthcare services. Shortage of quality healthcare services are not as user-friendly or accessible for Indigenous people as they are for non-Indigenous people. Location. Living in remote and rural areas are problematic as some health services are not offered outside of cities. Costs. Indigenous people are not able to use the health services available due to costs such as medications, surgery, and travel expenses to get to health centres. Living standards. Poor socioeconomic conditions such as overcrowding housing, waste management, and contaminated water are all profound effect on Aboriginal health. Poor sanitation and hygiene increases possibilities of exposure to development of acute rheumatic fever. House crowding. Young people are significantly more likely to be living in overcrowding conditions. In the years 2014 to 2015, about 1/4 of Aboriginal and Torres Strait Islander children aged 0 to 14 were living in overcrowded households. With tight and small living spaces, transmission of rheumatic heart disease is incredibly easy. Water contamination. Water supply in remote and rural areas contain components of uranium, fecal bacteria, and nitrates above the recommended levels. Body washing with this water and no soap introduces the higher chances of bacterial infections that lead to rheumatic heart disease. Education. There is a lack of education on rheumatic heart disease and health and well-being to the Indigenous community in comparison to the non-Indigenous community. Those within the Indigenous community are not aware of the health impacts that they have that will cause rheumatic heart disease.
According to the 2016 census, only 2.8% of the Australian population identified as Indigenous or Torres Strait Islander Australians. Within these results from the census, the most populated state was New South Wales with approximately 216,176 individuals living in rural towns. There are many health barriers that Indigenous people and children experience daily due to living in these rural and remote areas. Aboriginals have considerably low levels of usage to pharmaceutical benefits as well as Medicare. In some cases, this can be due to the level of care needed not being available in a reasonable distance, lack of transport, cost, and/or language barriers. When referring to children, this also applies to the parents, as they are the ones mainly initiating care. Language barriers are a hurdle to healthcare that urgently need to be looked at and corrected. Many Aboriginal individuals do not speak English as their first language. They may speak in different dialects. With the language barrier, many incorrect health diagnoses can occur. Health workers can easily confuse a second language English-speaking patient. This can occur by using Australian jargon, speaking too quickly, and not confirming if patients understand the information given by the healthcare professional. From these easily overlooked aspects, Indigenous patients can be misdiagnosed and mistreated, resulting in poor health. Lastly, a barrier that is frequently overlooked with Indigenous healthcare is the stigma created from Indigenous family members and/or friends with their stories of negative health experiences. There are many case studies on reasoning why Indigenous individuals have avoided healthcare, resulting in being a barrier. These individuals have either experienced racism in the health field or feeling of insensitivity when referring to culture. From hearing these stories or knowing people with these past experiences, it will inadvertently lower the probability of patients and parents taking their unwell child to receive health, potentially resulting in child mortality or morbidity.
How the barriers to healthcare services impact on Indigenous children is extremely detrimental in Australia, but there are a number of enablers for Indigenous children and changes that could be implemented to assist them in achieving a better quality of healthcare and accessing these services. One of the major problems Indigenous people state as a problem is accessing healthcare services. People find it difficult to access transportation options and public transport to reach the appropriate services. Informing people about the range of public transport options can easily address this problem. These include trains and buses that are quite often available in small towns, and trams that are often available in larger towns and cities. These public transport options can be subsidised or be available at more affordable prices if an individual holds a healthcare card, pensioner card, or concession card, for example. For children and teenagers, these are suitable, affordable, and accessible options for reaching healthcare services, but may require to be accompanied by an adult depending upon their age. In Australia, rheumatic heart disease control programs are available. These programs are funded under the Australian Government's Rheumatic Fever Strategy and are available in 4 states and territories: the Northern Territory, Western Australia, South Australia, and Queensland. The control programs in Australia are targeted at people who are at risk or who have acute rheumatic fever and rheumatic heart disease, and keep records of these details on acute rheumatic fever and rheumatic heart disease registers. A lot of information regarding rheumatic fever disease is available in options that adults would understand. The awareness of these diseases needs to be made available for all age groups, especially children, as they are the future generation that may be facing this disease. The implementation of educational programs or information sessions needs to be made available for Indigenous children. This would require the sessions to be accessible regardless of the child's location. The sessions would need to be cost effective, and it would need to be essential that the sessions were easy to interpret for the Indigenous children. The implementation of a translator may be necessary during the session for the reason that English may not be their first language. A more preferred option would be for an Aboriginal healthcare worker or someone who is educated in the field to conduct the session themselves. This is due to the fact that it has been shown that Indigenous Australians would prefer to receive healthcare advice from other Indigenous Australians.